Hi, this is Congressman Mike Levin. This week, the World Health Organization deemed the coronavirus a pandemic. The House is taking significant action to fight this disease and to keep Americans safe. This is a time for leadership, not partisanship, and in my decision making, I'm going to be driven by science and the advice of our medical professionals. The action I support, the Families First Coronavirus Response Act, is a set of measures to help families impacted by this crisis. The bill ensures that everyone, regardless of your health insurance status, will have access to tests at no cost. It strengthens food assistance for low-income families and seniors. It gives states more flexibility and resources to expand unemployment benefits. And it includes stronger protections for healthcare workers and safeguards for Medicaid benefits. One of the most important pieces of this bill is a new emergency paid leave program that replaces a significant share of lost wages so that those who take leave to avoid spreading the virus can pay their bills. I spoke on the House floor earlier this week advocating for paid sick leave to make it affordable to stay home and miss time from work, so I'm glad this measure is included in the bill. I strongly urge the President and the Senate to move quickly to enact this legislation so we can provide immediate support and resources for families struggling with this crisis. As a reminder, we passed $8.3 billion in emergency funding last week to develop vaccines and diagnostics, procure medical supplies and pharmaceuticals, support state and local health agencies, and more. We also passed strong protections against price gouging to help ensure that vaccines and treatments are affordable for everyday Americans. It's also important for everyone to follow Governor Newsom's recommendation against having gatherings of 250 people or more. Please do your best to follow that guidance and other advice from our excellent local health professionals in San Diego and Orange counties, as well as the Centers for Disease Control and Prevention. Make sure to wash your hands, avoid touching your face, cover your mouth when you cough, and stay home if you feel ill. Following these guidelines will not only help keep you and your family safe, but will also help prevent the spread of this disease to more vulnerable populations, like those with serious chronic medical conditions or older individuals. It's on all of us, each of us, to do what we can to prevent the spreading of this virus. So again, I want to encourage everyone, remain calm, take reasonable precautions. We'll get through this crisis together. And finally, please visit coronavirus.gov to find more helpful information. Thank you, and have a safe weekend.